So, Dr. Bagai, which is a bigger demon, air pollution or plastic pollution?
Both of them are equally bad and both run parallel. Unfortunately, plastic is also there in the environment. Can you imagine major residential colonies in Delhi and other places have open waste dalhouse outside the main gate? This is causing cancers, chronic obstructive lung disease, asthma, hypertension up to a radius of 5 kilometers.
A lot of time, I think we connect plastic with the environmental pollution. Do you think there is no enough discussion or focus on the plastic's impact on health, which is direct?
Mothers who have a high exposure to air pollution during pregnancies or even before that, high exposure to plastic, which then can become nanoplastic and microplastic, have structural abnormalities of the kidneys in the fetus. That means you can have an absent kidney, you can have a split kidney, you can have a bladder which is dysfunctional inside the mother's uterus.
Recently, the Delhi High Court and then the government is also actively, I think, working on how we set the temperature of the air conditioning in a level that it has a lower emission. How do you see that as a problem, and do you think that this makes a lot of sense?
Regulation or keeping a limit on the temperature is sensible. There is enough international published data to show you can save from 25 to 35% of energy.
What are the ways you suggest, how families, how parents can reduce the use of plastic, how children can do that, how we as individual can do that, and what are the areas you see that?
Please do not bottle feed a baby. Bottle is plastic, the nipple is plastic. You are feeding a child a slow dose of poison with warm milk. Please use a simple bowl and spoon, katori chamach. Bottles should be banned.
How good it is to heat up the food on microwave and consume?
Is microwave overall safe because of the waves? The answer is
Welcome to How Boring, a podcast where we uncover the most fascinating stories in public health, medicine, and well-being. And today, in this episode of How Boring, we have one of the most respected and visionary minds of India's healthcare, Dr. Sanjeev Bagai. Dr. Sanjeev Bagai is a veteran pediatric nephrologist and a health visionary, as well as the recipient of India's two highest medical honors, the Padma Shri and the B.C. Roy Awards. So let's discuss with Dr. Sanjeev Bagai some of the most important and critical informations related to our health and the system which makes us healthy or prone to diseases. So welcome, Dr. Bagai, to
Thank you for having me.
Episode of How Boring. This is an interesting month when we are meeting and having this podcast. IHW Council hosts and organize from 1st of July to 7th of July a gratitude week, where we try to bring the public gratitude for our doctors, for our medical professionals, and we are meeting in that month. So my gratitude to you also for that. So let's begin, by starting how you initiated or what took you to the area of medicine, what made you to choose medicine as a career and go for the healthcare leadership where you are today.
I come from a very humble background. My original family my parents were migrants from West Pakistan after partition, and we had to begin from zero. In school and college, most of the time I was a good student, primarily on scholarships. And I was very, very active in sports, hugely active in sports. And I played a good level of cricket beyond university level. And I was in rugby and various other college and university teams, including hockey and football and athletics. And my father was an engineer. My family was of lawyers. So it became very natural as a young age to start thinking of engineering. So I appeared for all the engineering exams. And there was no concept in late 70s of an aptitude test and so on. So I took all the subjects which were available in class 12. And I got in some of the colleges which I wanted to in engineering. But since I was very actively pursuing cricket between the age of 15 and 17, 18, I was not keen to leave Bombay. My dad was posted in Bombay at that time. So the next option was medicine, because medicine I was getting a good seat in Bombay itself. So medicine came to me, I think, by destiny, by chance, God's will, and I've enjoyed every moment of it. No looking back. It's been an extremely professionally and emotionally satisfying journey for the last 40 years plus. So my first love was always sports. I wanted to do engineering, but I think God has his way, and here I'm in medicine.
So I think your the journey from being interested and more passionate towards sports and then engineering or trying for engineering and then medicine, that also had some role in your, later on your work as a healthcare leader, administrator, and where you also tried to build certain hospitals in terms of creating them more future ready, more tech oriented and all that.
So I came to Delhi in 1992, and not being originally from Delhi, born and brought up in Bombay and some other places within India, because in a government job, my dad was posted in various places. So I think travel is a great experience. It's a great education. Different languages, being exposed to different cultures in school and college is a great education in itself. And I was a senior consultant in Batra Hospital for a good part of about 15 years. And then I got a chance of being a director and helped build some hospitals for Rockland Group. They had 3 hospitals, totaling about 800 beds. Then I was invited to become the CEO back in Batra in 2009-10. So I became the chief executive officer there. And administration was something which was always very close to me. And I think administrative skills, so to say, are there in everyone. It's a question of how you recognize it and how you hone it and how you manage not only yourself, but your team with you. And then I got an opportunity of going further. Then I was the CEO of Radiant Life Care, which was building a hospital in Sarai Kale Khan here, near Lajpat Nagar. And then subsequently, I built a 500-bed hospital in Dwarka for another private hospital. And just before the pandemic, then I moved out and now pursuing various other ventures and adventures. So it's been a good journey, fruitful journey. But I think all through, in the initial phases from 2009 onwards for the next 2-3 years, I used to wonder why buildings can suddenly become hospitals when they're not designed to be so. Why a hotel can become a hospital, or how a hotel can ever become a hospital, or any other structure is just converted into a hospital. So I spent a lot of time, many months in US and Canada learning, actually physically being there with the architectural and the engineering teams who build and create hospitals of vast international
And you
repute.
started this before COVID?
Much
Long
before
back.
COVID, much before COVID.
Because in COVID, we saw that this reutilization or repurposing of lot of hotels and such
Correct.
places for at least a certain level of medical care.
You're absolutely right. But this was almost 10, 15 years before. And I learned and I self-taught myself that building a hospital is an art. It's a science. Building of a hospital requires a different finish than building a corporate office or a hotel or any other any other building. The medical layout, the installation, the medical planning, the systems in place which are required for a hospital, the digitalization process. And I spent a lot of time with IBM at that time in University of Pittsburgh, learning how they travel through the journey of going digital. Spent a lot of time in Canada, some time in UK, and learned the art of building the hospitals. So this was then utilized when I came back, and very fruitfully so. And digitalization process, what we call as building digital smart hospitals, is a journey which I think every hospital needs to embark on. It gives you a better ROI, it gives you better clinical results, it gives you an enhanced customer, which is a patient experience. It gives you administrative skills. It gives you a better inroads into supply chain management, smarter operation theaters, better utilization of manpower, better utilization of equipment, and overall you get better clinical outcomes, which are evidence-based. That's the key. The core is the patient. The life is the patient. The soul is the patient. We work for the patient. So every effort which can give a better recovery and better clinical results, better survival rates to the patients, that's what medicine is for.
Very interesting, because in IHW also we talk a lot about patient centricity, how you put the patient at the center of the care. Anything, whether digital integration or the medicine research or the care planning, or for that matter infrastructure creation, the hospital making, everything has to be created for the patient, the soul of the.
Yeah, so I think when as an administrator, when you're trying to create and build from scratch what we call as digital smart hospitals, it's about having a correct attitude, what your aim is, what your focus is. And you'll have ups and downs. And very often, I always say that 99% of things which happen in our life is according to the attitude we embrace for ourselves. Only 1% is because of the external situation. 99% is how we react to that situation. So I think in a path going forward, you have to be open-minded. You have to have your team in front of you. You have to think of your team. You have to think of patients first. They are the core soul of our existence. So we live because of them and not the other way around. So I think we have to put patient first. The patients are the stakeholders. They have to be a part of the decision-making cycle. So things like home care, ambulatory medicine, these are all things which are patient-centric. The newer avenues like robotic, intuitive surgery, stem cell surgery. Now, I think in the next 1 or 2 years, India will see regenerative medicine. These are things which will outpace all the old concepts. So I think medicine is evolving in an extremely fast pace. And we are fortunate that we are living in an era of such advanced technological advancement. So I think it's good for the patients and it's good for the medical system.
So I would like to, request you to decode two terms a little bit more, or explain for our audience. Patient first healthcare. What all it should, how it should come across to the patient in terms of, multiple aspect, how they reach to healthcare, how they navigate the healthcare, how they come across to a doctor, all that, which is a lot of nuances and, a lot of those subtle aspects related to health, a lot of soft skilling of the healthcare professional, which can make a patient, feel more easy, more empowered, more, satisfied maybe from the outcomes or the process. And the other word which you mentioned about is smart hospital, how those smart hospitals really look like. Is it all about having those sci-fi hospitals where everything may be happening on gadgets? You may see more robots than the humans. Is that the smart hospital? So let us, talk more about patient first and then smart hospital.
Yeah, so first, describing patient first, when you say patient-centric care, or when you say our entire aim is based on evidence-based medicine for the patient, by the patient, I think we have to keep the patient in the center of the circle, because they are a part of the decision-making cycle with us. And the core philosophy of being patient-centric is continuing of care. So the care doesn't actually begin and end in the hospital. The patient may be having an ongoing problem at home. So it includes how the patient is looked after at home. What is the need of hospitalization? What is the ease of comfort of shifting the patient to the hospital, either on an OPD basis or in a critical emergency that includes ambulatory care? When the patient steps into the hospital, the patient is coming in stress. So I have always again stressed on the fact that there is no line in apart from medicine which is more challenging, more physically, emotionally, mentally demanding and challenging. But the real issue is that you have to think of a patient as a soul. The patient is coming as a human being in stress. Patient is not a bed number. Patient is not a ward number. Patient is not a description of a disease. A patient comes to you in seeking help. And I think we have to reach out to the patient in that same aspect. How the patient is dealt with when he comes to or she comes to a reception, how the patient is guided to the outpatient department or indeed the process of admission, what is the comfort the staff can give to a patient during the course of being shifted to the room, or the explanations which are required by the paramedical staff and the medical staff of whether the patient requires surgery or some intervention or is going to be shifted to the ICU or the cath lab or for dialysis. There are so many moving parts. I think the patient's relatives, the family must be also kept in comfort and in full confidence. It's our duty to inform all medical details to the family. The transparency comes with that. You have to place the facts in front of them. Doctors are not God. What doctors can do is the best for the patient to the best of their ability with utmost honesty and integrity and utmost intellect. The ultimate healing is by God. We have to be a part of the cycle with the patient to give them as much comfort. We've seen a lot of patients who are in terminal stages. How do you give the patient and the families that kind of comfort? Patients also come with a lot of financial distress. Private healthcare in India, although is cheaper than in Western countries, but doesn't come cheap for a lot of families because the insurance cover is still low. So I think it's an overall dimension in which you have to give a patient, treat them as one of your own, and you'll never go wrong. The greatest message which I can give to any youngster who's joining medicine or pursuing medicine is treat the family member as your own family member. Treat the patient as your own. You'll never go wrong.
Right. So you talked about that doctors and healthcare system is more of a facilitator of healing. It's not absolutely in the hand of the medical professionals to heal it. It's also a process which I believe also comes from the confidence of the patient as well, because it is a patient so own mental state and the mindset and the confidence which helps the faster healing or the recovery. You talked about that explanations to the family or the patient to understand what is the medical process they are going into, what are the the different aspect to it. But we have seen that many times doctors or maybe specialists don't have that much time to explain, which has also led, and it has been global studies are there that the time spent by the doctors with the patients are very very less. Maybe that is because of the number of patients you have or the the load you have. How do you see that? Do you really see that spending a bit more time with the patient, explaining a little bit more in clarity with empathy does help in the healing process faster, and which can also avoid a lot of pitfalls maybe for the healthcare?
Yeah, I think you have to put yourself in the shoes of the patient. The patient may be already knowing what the diagnosis is. Patient may be fearful of a particular procedure or a surgery. Patient may be fearful of the outcome, long-term impact on the longevity of life, the complications, the finances involved in treating now and ongoing treatment. So I think spending time with the patient and the family together is of utmost importance. There is so much of healing by just talking to the patient. I also want to stress something which very often is neglected by a lot of younger doctors these days is history taking. History gives you so much of information, and then your treatment and investigations can be fine-tuned much better. Your approach is a lot more smarter. And using the word smarter to address your second question, which you asked, is what is the concept of building digital smart hospitals? So digital smart hospitals gives you 5 basic benefits. One is it gives you better administrative outcomes. It gives you better clinical outcomes. It almost decreases to zero hospital-acquired infection. It decreases the risk of human errors. It gives you a better financial outcome. Your ROI on your investment is much better. More importantly, patient has a better experience. So the time which it takes for doing mundane paperwork is eliminated. The patient does not, or the family does not have to go out of the room or to the reception or to wait in long lines for any amount of queries. Everything can be addressed from the room. The information is also given online. Patients can access this on the television screens, on the iPads, and so on and so forth. More importantly, from a medical professional point of view, your decision making becomes so much clearer, sharper, quicker, because your approach is filtered through AI generated apps in which you rarely will tend to miss a diagnosis or a particular set of investigations, which actually boils down to giving you better clinical results. So we've seen this in oncology, we've seen this in cardiology. One of the first models which was gotten into India, in which I facilitated the entire process, was the AI model of Watson through IBM, which was mainly in oncology, but now it has spread into various other specialties. So a digital smart hospital is not merely a paperless hospital. A digital smart hospital is an overall functioning hospital which eliminates waste of time on things which we routinely take as necessary, removes the paperwork. It gives you a better return and better clinical output.
Wonderful. So when we talk about a smart hospital and the how it enhances the patient experience, obviously the removing a lot of those hassles and to and fro, or maybe much faster exchange or movement of diagnostic report, or multiple other history and all that which is stored. If we look at Indian patient mindset many time, and as a health administrator you would have come across, and as CEO of a hospital you would have, patient experience can go wrong in many ways. For example, a family is not being able to get 10 people in the room of the patient where they can, everyone can come and meet. And if they are not able to access, अगर वो hospital नहीं पहुंच पा रहे या उनको room में allow नहीं किया गया, तो वो भी एक patient experience, in our context gets, hampered. Maybe the quality of food or the taste of the food, the sometime they didn't get that typical chai they wanted. How do you also come across or came across such kind of a scenario where you feel that and you may like to have some message for the such kind of a patient and the caregivers or the attendants, that how they actually be more responsible when accessing healthcare, and so that healthcare really can work in an optimum way to help them?
I think this is seen very, very often, and it's a point, I'm glad you brought it up. It's a point which is really actually discussed or addressed. So when a patient comes to a hospital, he does come with some support, some family members or some relative or children or wife or some neighbors. But what is important to understand is hospital cannot become a social meeting ground. It's not a coffee table discussion, oh, let's go and meet there. Let's meet there and then we'll decide where else to go. It's not a transient stop for going elsewhere. I think the core of reducing hospital-acquired infection is restricting number of relatives into the critical areas, even in the lobby of the waiting reception area, the main atrium of the hospital. So I think that message is to be communicated as a public message of awareness that you're doing yourself good by not visiting the hospital or the patient. You can't enter into the ICU in any case, or into the operation theater area, the pre-waiting room area, or critical areas of, but even going and meeting recurrently in large numbers in the patients in the ward can be detrimental for the interest of your patient.
As so well as you.
And us. So it's very important that many times the patient's relatives carry subclinical or asymptomatic or pre-symptomatic infections. So the entire infection can spread all over, not only in the hospital wards, but even to the healthcare workers, to the nursing staff. So I think it's a mode of communication. It's a style of communication. It's to tell them the benefits of what is right and what is wrong. The fundamental point is to maintain discipline.
So, Dr. Bagai, you are a pediatric nephrologist, one of the top and most reputed in our country. Many time, or maybe for our audience, this pediatric nephrologist may be a little unheard term, maybe. What does pediatric nephrologist really do? And when it comes to nephrology or a kidney health or kidney care, how much is the relevance of nephrology in children's health, or in what is the burden of kidney health issues in children?
So after doing pediatrics, so you do MBBS for 5.5 years to 6 years, you do 3 years of MD in pediatrics, and then you either do a fellowship or a DM in pediatric nephrology. That's for another 3 years. So after you leave your high school of class 12, it's another 12 years of very high intensive academics, research, long hours in the hospital. During these 12 years, you learn how to deal with yourself. Because the pressures of exams, the academic course, the volume of information which you have to read and retain is huge. So pediatric nephrology has evolved in the last 30 odd years. I did my fellowship in Sydney in 1992-93, so it's been a long time. So we have now degree courses available in India for the same. So this deals with the kidney, the ureters, the urinary bladder, and the overall metabolic health, not only of the babies, but of the fetus before the baby is born. So I have a very vast experience in antenatal care of fetal kidneys. So the babies may be having swelling in the kidneys or inflammation in the kidneys, obstruction in the kidneys, duplex kidneys, absent kidneys, wrong flow of urine, and things like that. So either we can intervene in utero or immediately after birth. So the trick here is to identify the babies being born who are already at risk. And we intervene as early as possible, not to let the disease establish as an established chronic illness. So we save the kidney lives. 20, 30 years back, before all these technology and imaging facilities were not available, and the knowledge was still evolving at that stage, a lot of these children left undiagnosed, undertreated, or partially treated, partly understood, and these same children are now in the chronic kidney disease program undergoing dialysis and transplant. So the commonest thing which we pick up in children is urinary tract infection. The commonest thing is what we call as other infections of the kidney, what we call as nephrotic syndrome, or illnesses which involve the urinary tract in terms of structural abnormalities or infection or inflammation, or indeed immune causes, autoimmune causes. So it's a broad group of illnesses which are treated by pediatric nephrologists. Kidney is a silent factory, storehouse, resource of the body. So it not only filters blood to form urine, but it controls things like hypertension, it controls things like your hemoglobin, your calcium, your vitamin D, and a host of other functions. So the fluid overload or underload. So your kidney is the basis, but it's a silent functioning organ. It doesn't reflect in the blood till 50% of your kidney function is lost. So the level of awareness which you need to give as public messaging is very important. So what kind of subtle signs to look for in children, especially newborns or smaller infants, what messages you give to the parents, that lies the key.
How many such children are diagnosed, and what is the prevalence in India? How many children are post birth, or is there a way to diagnose or establish this kind of anomaly before the birth in a prenatal stage?
Yeah, so India produces approximately 29 million newborns every year. So the overall incidence of fetal renal abnormalities is 1 to 2%. So you can imagine the volume of load which is added on as new index patients.
Like, for example, 65,000 around childbirth every day.
Correct. So you can 1 or 2% of that.
2%.
Right. So, and out of this, 0.5% are serious abnormalities. So serious abnormalities means if you do not do intervention, either surgically or medically, these children will lose the kidney function in the first 5-10 years and ultimately land up in chronic kidney dialysis programs or on a transplant list.
So in how many years?
In a period of 5 to 10 years.
5 to 10 years.
Yeah. So before the 10th birthday, a lot of these children have significant kidney dysfunction. So really the essence is early diagnosis, early intervention, early treatment, and then follow-up. The holistic game is to inform the parents, inform the gynecologists, inform the ultrasound people what to look out for, because you have to tell them what information you're seeking. So now we have such advanced 3D and 4D ultrasounds, color Dopplers, even of the fetuses, that we know very well and what exactly to what severity, what depth, what dimensions, which kidney, which ureter, where in the urinary bladder, lower part of the urethra where the fetus passes urine from, what kind of abnormalities we are envisaging, and what to do immediately after birth.
And all these investigations are routine part of the...
Absolutely, we do them every day. Every day, yeah.
Can all the children be saved from getting into dialysis kind of a situation if we are acting early, or we are, resorting to the right investigation and treatment?
I think 98-99% of them can be saved from what we call as CKD, that's chronic kidney disease. Very small percentage will, irrespective of what we do, progress to it. Things like bilateral agenesis of kidney, that means no kidneys. The child is born with absent kidneys. Or very well established reflux nephritis, that means the urine is flowing the wrong way right through the inception and conceptualization of the fetus. So the earliest we can pick up is about 12 to 14, 15 weeks of kidney problems antenatally. That means at the end of your first trimester, you can establish what's going wrong in the fetal kidneys. And then if at all we identify index fetus at risk, then we follow that up even more closely.
So these children with the, kidney related malfunctioning, anomalies, what is the cause of that? Is it the, developmental issue, or is it a, certain lifestyle related issues? Is it because of the certain lifestyle choices of the parents, or certain disease, or underlying health condition of the parents? What leads to this?
Okay, so very interesting. Huge chapter, but let me concise it quickly for you. So you're dealing with basic broad groups. So one is structural abnormalities. So your kidney can be in a wrong place, the kidney can be absent, kidney can be swollen out of shape, kidney can be shrunken in uterus. That means this is all happening before the baby is born. And immediately after that, of course, we follow up with the required investigations or treatment as required. So one is structural abnormalities. Second broad group is infections. So infections can be viral infections, bacterial infections, fungal infections, or indeed infections which cause chronic inflammation. So from infection, now I'm coming to inflammation. Inflammation means your tissues and your cells are in a chronic state of war inside the kidneys. Then comes another broad category called as autoimmune. Things like what we see as systemic lupus erythematosus or other rheumatological problems which infect the kidneys. So these are broadly
where
4 or 5.
The immunity has gone haywire.
Correct. That means your own body cells are fighting against your own cells. So a lot of factors come into this. One is, of course, parental age, parental lifestyle, diabetes in the mother during pregnancy, hypertension, prematurity, huge risk factor for the kidneys, small for gestational age, chromosomal abnormalities, in consanguineous marriage. That means if there is inbreeding in families, which happens in certain communities all over the world. Alcohol intake, especially for the mother, immediately pre-conceiving and during pregnancy, smoking, drug intakes, substance abuse, taking certain antibiotic drugs which can affect during pregnancy, which can affect the fetal kidneys, More importantly is the overall lifestyle. Obesity is a huge risk factor even for the fetal kidney, obesity in the mother. And then comes to the environmental effect, in which environment we are living in. And it's a very poignant moment that what we never talk of so often, what we don't want to talk of so often, because it's a white elephant in the room, and we've allowed that small little mouse to become a Frankenstein for us now, is environmental pollution, which is impacting the maternal health, therefore impacting the kidneys of the fetus, the heart of the fetus, and the plastic. And there are now enough and sufficient research material available to show that mothers who have a high exposure to air pollution during pregnancies or even before that, high exposure to plastic, which then can become nanoplastic and microplastic, have structural abnormalities of the kidneys in the fetus. That means you can have an absent kidney, you can have a split kidney, you can have a bladder which is dysfunctional inside the mother's uterus. So I think we need to pay a lot of attention not only to our health, but the climate and the environmental health.
So here we come to an interesting aspect of health and what impact our health. And we have seen that you have been one of the, I think, most vocal and committed warrior against the air pollution and the multiple other pollutions. So what you said that when parents or we as a people are exposed to multiple environmental pollutions and all, it is impacting our health, which is leading to multiple the challenges can go to lead to fetal kidney issues, even structural issues where the missing kidney and all that. So I would like you to give a little bit more focus on it and a little bit talk about it more, that what are the environmental issues, how they are impacting our body, our organs, and how they are leading to a certain deficiency or a problem in our next generation, how those typical pollutions are coming across to us. Many of them are very visible, let's say. So Delhi's polluted air is something which is visible to all of us, measurable even. But there are multiple other pollutions which are invisible and we can't even see them and we don't realize.
So two broad categories. One is air pollution as a large, and the second is the plastic pollution at large. So first beginning and concentrating on the air pollution, I think very often the celebrated rascal culprit is PM 2.5 or PM 5. But that's just one amongst the many thieves, so to say, in the gang which comprise and make air pollution. So you're talking of particulate matter, you're talking of smoke, you're talking of volatile organic compounds, you're talking of toxic carcinogens, you're talking of toxic gases, you're talking of particulate matter, which is apart from these substances called as hydrofluorocarbons, pre-carcinogens, carcinogens, and then it comes to various gases like methane, NOx, SOx. Overall, what we breathe is what we absorb. So the impact first is on the lungs, upper airway and lower airway, which is the lungs, and then it goes all over.
How bad air we have? You talked about so many, I think culprits, and you have very well given an imagery.
PM 2.5 is one amongst the particulate matter which seeps down lower, but PM1, that means sub-micron level, can go even further down into the smaller little airways, or what we call it the alveolar sacs of the lung. What all these compounds overall do is it brings your lungs and other organs into a stage of inflammation. Acute inflammation, acute on chronic, and then chronic inflammation. What does this do in the body? So it's the number one cause of lung cancers, brain cancers, cancer of the pancreas, cancer of the stomach, CA breast, cancer of the genitourinary tracts, and so on, cancer of the kidneys. Apart from this, it involves the brain. You can have strokes, you can have cardiovascular events, you can have metabolic dysfunction, obesity, hypertension, arrhythmias, indeed cardiac arrests. There are studies now which have shown a 10% increase in PM 2.5 gives you a twofold increase in cardiac events. It has shown 1% increase in PM 2.5 has a direct correlation to 4% increase in mortality. 5% increase gives you 8% increase in mortality. And what we are seeing in AQI in Delhi, today's newspaper read that Delhi is the second most polluted city in India. That's not a good tag.
So we have been holding this, I think, feather or
so the only
distinction for quite some time.
Yeah,
dubious distinction.
Yeah, so the only way to address this problem is to identify it, is to recognize it. And you got to address this shamelessly. You have to hold the people responsible. You have to bring policy decisions. You have to take, I would even go to the extent of saying this is the number one cause of death worldwide. There are 5.5 million people dying because of air pollution annually all over the world, out of which 2 to 2.5 million are dying in India directly because of air pollution.
2.5 million.
In India only, every year. That means we are having multiple COVID-like deaths every year.
25 lakh.
Every year. And largely this is preventable. So why are we not preventing it? We are allowing this generation to suffer and die. People in Delhi are losing up to 8 to 10 years of your adult life. That means instead of dying at 80, you may die at 70. Instead of 90, then at 80. That's not fair. You're allowing the next generation, that means the smaller children, to die. You're allowing small kids to have diabetes and hypertension when they grow up. You're allowing the fetuses to be harmed in utero. That's not fair. Then why are we living? What are we living for?
So today's pollution can harm up to how many generations?
Many generations down, because it damages your genome. It damages your DNA. These are published studies. Sometimes people say, oh, these are all Western studies. And I've researched this so thoroughly, there are more than 150 Indian-based studies in which they've done multicentric trials across 26 cities all over India, 9 cities all over India. It's all published in Lancet, New England Journal of Medicine, British Medical Journal, ICMR details. This is all available. I will very strongly request the government to have a separate ministry to combat air pollution. This cannot be done just by the way. And you need proper scientists, you need researchers, you need doctors, you need environmentalists who are a part of the decision-making cycle.
But there are multiple task forces, there is which are taking up the cause, trying to coordinate with multiple.
Position without responsibility and not giving results is no position. This is not a time in which we need newspaper headlines. This is now a time to implement the policies and be strictly enforcing decisions and punish the people who are guilty. Why are there farm fires still burning in Punjab? And we talk about air pollution only in the winter months. Air pollution is happening 24/7, 365 days a year. People are dying even in summer. Yeah. Why are we allowing this to happen to ourselves? So it can be industrial pollution, it can be road traffic pollution, it can be road dust, it can be construction norms, it can be farm fires, any source. We cannot bring pollution down to zero, but we can substantially decrease it. And our aim must be and should be, and it has to be towards that.
So recently you have seen a flurry of action in Delhi, especially the most recent one of deregistering the cars which have reached to their so-called end of life, which are 10-year-old for petrol or 15-year-old for diesel. And then you also saw some of the government took back that action, and then that has stopped that. We saw they're being denied for the fuel in the petrol pump or being impounded. How do you see the actions like this, or maybe for that matter, the sprinklers being deployed, or the other activities which has happened over the period, odd and even for that matter? How much of that really helps, or we require something more comprehensive, more systemic? What should be the way forward, and are we going on the right direction? Even if slow, are these things going to help?
Okay. So, with your permission, just before we come to the cars issues and the registration and the emission norms and so on, just a quick word on something which we call as black carbon. And black carbon is precipitated basically through your emissions from the cars. And the second is plastic. And a quick word on plastic, which is extremely important, is poorly understood, widely rampant, killing us every day. Simple tagline. Plastic,
Can you repeat it again?
plastic kills us every day. It's rampantly increasing. It is there all over, and we fail to address this issue. Plastic does not disintegrate or degrade in the environment for over 100 years. You throw a plastic bag today, it will still be in our environment for 100 years plus. You see the beaches, you see the forests, you see the roadsides, it's plastic. We are living in a plastic world. We cannot decrease it to zero, but we can definitely do a lot to decrease the damage and decrease the use of plastic. Plastic enters the body mainly through ingestion or contact. It dissolves,
Even the
contact through the skin. And it is absorbed in the body and it forms into small fibers, what we call as microplastic, which is less than 5 microns, and then nanoplastic less than 1 microns. Plastic has more than 75 toxins, including resins, including carcinogens. But the 4 disastrous ones are what we call as bisphenol A, what we call as BPA, phthalates, what we call as DHP. Third is called as antimony, and fourth is called as formaldehyde. These are the ingredients which are used in paint, which we use on the walls, on the wiring of electrical wiring of the tubings, and the exhaust which come from the cars. These are resins. These are carcinogens. What do they do in the body? 9 different types of cancers, established, proven, researched, published. It causes women to have highest rate of infertility. It destroys not only the ovaries, but even the sperm count in small children. Causes of infertility are actually one of the causes is plastic pollution. It causes damage to the brain, hypertension, diabetes, obesity, you name the organ and plastic hits it. Worst of all, it is called as an endocrine disruptor. It is anti-estrogen. So your receptor in the body, which is used when estrogen is released, plastic comes and takes that place. So it's anti-estrogen. Estrogen cannot act in the body. Estrogen is required in the body. So all your hormonal defects, your cardiorespiratory metabolic defects are because of plastic.
And at the same time, it will also have impact on mental health because of
hugely. Cognitive dysfunction, low IQ, attention span. Children are suffering because of plastic.
So can we also connect the lot of increasing incidence of ADHD or all that?
Hugely. And there is data on this. You're absolutely right. You're spot on. Like I said, we need a ministry to combat pollution, air pollution and plastic pollution. This cannot be one minister managing 6 portfolios, out of which one of them is trying to combat pollution.
But for plastic, even the Prime Minister took this very strongly, and we announced that there will no single-use plastic, and there is a whole the government initiative, focus, regulation.
So let me hold this up. And the best thing which is in this podcast is that water is served in a glass. It is not in a plastic bottle. So there are studies to show that PET bottles, which is plastic bottles, has a direct leaching effect. Higher the environmental temperature, greater the leaching of plastic from the bottle container into the liquid. Longer it stays in terms of exposure, greater the leaching effect. So every bottle of plastic water you're having microplastic going into your body.
So if a PET bottle which has water and which is exposed to higher temperature, which is possible during
all over India,
transport, during storage and all that, it is emitting certain kind of...
As 100% proven fact.
So it is not that the plastic bottle itself is a cause of a big pollution, because many of the companies now prove or claim that they are doing a lot of recycling and they are able to pick back all the bottles, or let's say 90% of the bottle, and recycling them to ensure that there is no, bottles lying and
But the
scattering them.
core, but the core issue still remains the same.
Yeah. So that's yours. That means even if you are discarding or recycling your PET bottles very well,
You're still
health damage is
having
there.
plastic leaching into the water. And these studies have been done not on one make, I'm not taking the name of the makes, but not one make, but at least 10 different makes. And these studies have been done in India. You have higher level of phthalates. They have even done post-mortem reports to show microplastic and nanoplastic in the brain, in your coronary arteries. Your heart attacks are not only because of lipids or a blockage as a blood clot, because of lifestyle. It is because of plastic style.
A lot of time, I think we connect plastic with the environmental pollution. Do you think there is no enough discussion or focus on the plastic's impact on health, which is direct?
We need separate sessions on this. We need public awareness campaigns on this. And this is the greatest gift which we can do in our lifetime to save the next generations. The answer is an emphatic yes.
So let's say when we are looking at the systemic change, government should do something, new ministry should be there, and obviously I think to take up the task of this magnitude, there has to be something more substantial. When it comes to our day-to-day choices, how much we can contribute, or can we? Is it about that akela chana bhar nahi phod sakta kind of a thing? You might have heard about this Hindi saying.
So the most expensive thing and the valuable thing in the world is an idea. And an entire momentum, an entire chain of events can be started just with one thought, one person. We should not underestimate and under-evaluate our own efforts. But we need a combined effort of the society, which is the community and the government. So let's begin with all industries, especially coal industries, thermal plants have to be shifted outside metros. Point number 2, we cannot cut a tree. We have to plant trees. Illegal tree felling has to stop. And I was one amongst the petitioners of holding people responsible for this in NGT and in Delhi High Court.
And I think this was for the area of Vasant Kunj.
Vasant Vihar.
Vasant Vihar,
Yeah,
sorry.
where illegal hundreds of trees were cut for personal benefits. Either access into your house or obstructing a particular car coming in. It's criminal. Next is the government part. Having air sprinklers or smoke towers is putting a superficial band-aid on a gangrene inside. It's a very expensive, even the artificial rain and things, very expensive, futile effort or very limited gain. Why can't the roads be laid end to end? A 20 feet wide road will have tar, which will last only a while, and the remaining 3 feet on either side is dust. You're allowing road dust to go on. You need better public transport. You have to stop the farm burning of the crops. Industries outside Delhi. You need smarter management of Delhi traffic. Western countries have done it beautifully. We have the technology of digital tracking traffic. You have to allow certain routes to ply at certain time. We still don't have multi-level car parks in Delhi and in major areas, major metros. It will decongest the place. Allowing rampant double, triple parking on either side of the road slows the traffic. Burning cars in a stationary place emits more amount of emission. Coming to the concept of 10 years versus 15 years, one is the age of the car, but the second more important thing is the maintenance of the car. I will go to the extent, remove all barriers. Pollution norm should not be once a year. Pollution check of the car should be twice a year, mandatory. The second point is, it should be done free. By taking 100 odd rupees, we are not going to get any richer. Make it readily accessible in every nook and corner of all places in India. It's not a very expensive machine to keep. If you feel that the car, even within 10 years, is not viable, take that car off the road. But the longevity of the cars is well beyond 15 years.
Yes, it depends on the maintenance and how it has been kept.
So my own suggestion is that the car should ply for 15 years. Diesel cars and diesel vehicles should be weaned off because that's a much bigger polluter. Smarter traffic management, digital control of traffic, better public transport, proper management of roads so that road dust is eliminated. Construction norms need to be maintained and make all metros greener. That's the way forward.
We normally see a lot of, you talked about that how stationary cars are creating more or emitting more than a moving car. And we see in many of the places, like for example, any day you come from Gurgaon to Delhi, or you might, when you are, I was coming from, let's say, Delhi to Noida, there are a lot of those MCD or, the municipality checkpoints which somehow, kind of slow down the car, and it becomes a big, jam almost every day. Do you think they also are they can make more impact in
Yes,
terms
indeed.
of
So in fact,
environment?
Mr. Nitin Gadkari ji has just mentioned that it's a one time in a year paying for a toll. And you don't have to stop from toll to toll to toll to toll to pay.
Yeah.
So I think we need to think in a binary fashion. We need to think more freely. We need to have more free flow of traffic rather than congestion of traffic. Illegal car parkings, the mafia, the nexus, which are holding roads to ransom, encroachments are destroying the Delhi traffic, Bombay traffic, and so on. I think we need a multi-level, multi-dimensional approach to this, but the community and the government have to work hand in hand. Air pollution has to be combated. It can be. It cannot be done as an afterthought. It cannot be done as just by the way. It cannot be done dekh lenge. It cannot be done ho raha hai. And plastic pollution needs to take center stage of discussion. There are enough information available. There is enough implementation which can be done, but we have not done it as yet.
So, Dr. Bagai, if we have to address one of them, which is a bigger demon, air pollution or plastic pollution?
Both of them are equally bad. And both run parallel. Unfortunately, plastic is also there in the environment. Can you imagine major residential colonies in Delhi and other places have open waste dhalals outside the main gates? They emit gases including methane, nitrogen oxide, sulfur dioxide. This is causing cancers, chronic obstructive lung disease, asthma, hypertension, up to a radius of 5 kilometers.
Almost the entire colony.
Yeah, why are we killing our own citizens? There is no rocket science in this. We need implementation. We need policies which can be on ground, driven in. And we need harsh punishments. So the bottom line is discipline.
But this is being, these all dalaos and all that, the garbage dump, small areas which has been identified. They're all done by the municipalities and all that. Are they not aware that they have a extreme health or high health impact negatively?
They have. I have actually written to the Lieutenant Governor on many occasions. I have written to the Chief Minister on many occasions. I have written to the MCD on many occasions. But unfortunately, most of the sites are still going on as open waste dhalals. What happens in these dhalals is a greenhouse effect. Because of the heat and the rain, the bio waste of the house degrades. It releases gases, hydrofluorocarbons, volatile organic compounds, which are all invisible gases. The reason why most of us pinch our nose and drive past in our expensive cars across these houses because it stinks like rotten eggs. That smell of rotten eggs is methane. There are studies which have shown 50 to 100 times higher concentrations of methane in and around the dhalals, which are causing cancers. We can build fancy hospitals and the highest technology to treat cancers, I think we need to start addressing the root cause of the illnesses. So we need to move from illness towards wellness. And nothing should obstruct our path in reaching wellness.
When it comes to greenhouse gas emission, as you mentioned, I think in modern or let's say in urban setup, and especially country like India, where we are in a tropical, climate normally, we have a lot of cities which have high heat in that way, and when we see the global uh, you know uh, kind of a heat increasing or the climate change, air conditioning is one of the area which is, I think, is also going rampantly, and almost every house, small or big, do need air conditioning, and it also, I think, has a substantial contribution to the greenhouse emission. Recently, the Delhi High Court and then the government is also actively, I think, working on that, how we set the temperature of the air conditioning in a level that it has a lower emission. And by default, you go in Delhi, in most of the restaurant or theater for that matter, and or for that matter even hospital, you see the temperature where you can shiver in a way. How do you see that as a problem, and do you think that this is makes a lot of sense for, in general, to have a regulation to have a certain level of temperature setting in air conditioning, because even a small fluctuation adds a lot of emission and electric consumption?
Yeah, so let's break this into two basic groups. One is medical institutions, which mandate a particular temperature from recovery of the patient or the surgical requirement. So operation theaters and ICUs have to run at a low temperature. That's mandated by medical science.
And that is needed.
So that is needed. But coming to commercial and residential buildings, however big a high-rise may be, or however big a house or a bungalow may be, regulation or keeping a limit on the temperature is sensible. There is enough international published data to show you can save from 25 to 35% of energy. Second thing is, rather than still getting stuck at local custom-made ACs or the old technology of ACs, which emit a lot of carbon into the environment, the newer technologies which have come, especially the ones with the VRV units, have a better temperature control, have better cooling with lesser energy consumption. So we have to move now from the old mindsets towards saving the environment. We cannot think of only our house, we have to think of our community.
Right. Dr. Bagai, as you have given equal weightage to both environmental pollution or air pollution or plastic pollution, air pollution, many times we are individually, we are not having much choices in terms of reducing or removing it from our life. For example, you have to go out, children have to go out and play, they have to go to school, they have to go to, we have to go to work and all that. Yes, we can select the choice of emission, but something which is directly impacting our life, which is plastic, what are the ways you suggest, how families, how parents can reduce the use of plastic, how children can do that, how we as individual can do that, and what are the areas you see that?
So broadly, 4 points come to my mind. Begin right from infancy. Please do not bottle feed a baby. Bottle is plastic, the nipple is plastic. You are feeding a child a slow dose of poison with warm milk, lying for hours. It's leaching. Plastic is leaching as microplastic, nanoplastic. In fact, now it is called as micro-nanoplastic.
But Dr. Bagai, keeping in mind, so breastfeeding is something which everyone promotes, but for working women,
please use a simple bowl and spoon, katori chamach. Bottles should be banned. I'm going to be hated hell of a lot after this podcast by a lot of commercial organizations. So be it. Bottle feeding is bad, not only from infection point of view,
so glass,
but from microplastic.
Bowl and chammach is okay.
Simple stainless steel, katori and chammach.
Right.
Time tested, pure, safe. Point number 2 is single-use plastic. Plastic bags, plastic containers should be stopped. Third is, we cannot make plastic into zero. But there are options available which are non-bisphenol A, non-phthalate plastics. And the government has to move towards that.
Do we have a way to identify
Yeah,
it?
there are plastics which are non-BPA, non-phthalates.
So like in toys, you see now non-BPA and all that.
Correct.
Is that
so? That's a safer form.
okay?
And third is, don't litter the environment with the plastic bags. What we do is we throw it into a bin and it goes into the environment. It goes into the ocean, it goes into the soil. The vegetables which we are eating, where the soil is, in the soil the vegetables are growing, has plastic. The water which comes into our water tanks has plastic.
So we use overhead tanks as a
Correct.
plastic
That's
tanks.
plastic.
They are PVC, I
That's
think.
plastic.
And they are exposed to 45 degrees Celsius.
For
50
months
degrees.
together. Plastic. And no RO
So
system
what
can
should
cure
we do?
that.
Replace them with a cement tank? Or?
Absolutely.
But that has its own issue of what you can say algae and
No, it's question of maintaining. Maintaining may be a little bit more tedious, but putting in an effort to stay alive is well worth it than landing up in the hospital. We have to look at various sources, step form. It cannot be a one-shot solution. We have to look at every step of the way. How can we decrease or eliminate plastic from our life?
Does that, in certain cases, we see that it is promoted that the white plastic tank, overhead tank, is better than the black one. Is that so?
In India, we can sell anything. Not true.
So we should do away with the plastic tank?
Absolutely. There are studies which have been done to show water samples containing micro nanoplastic. We are consuming that water. Micro nanoplastic filters through the RO. It's there maybe in this, maybe in anything else. So we have to look at ways. We can't have water being sold in various kinds of, by various companies. It is sent through trucks from a factory, open air trucks, 40, 45, 50 degrees temperature in most parts of India for 7 months a year. It takes hours for the transportation to happen. It reaches a shop. Every shop has water bottles packed on the pavements outside, exposed to the heat.
Exposed to all type of temperature.
आपको ठंडा चाहिए तो वो ठंडा लेके आएंगे.
Right, but it is not always thanda.
But
Yes.
it was warm 1 hour, 2 hours before.
Right, for maybe months.
For months. So at least at home, we should start using water bottles. Major cafeterias, all hotels have shifted to glass bottles. And we need to make every concentrated effort to move towards glass or stainless steel and not plastic.
So that's one thing, water bottle is the one aspect. But I think as a modern day consumers, we are dependent or we are consuming a lot of other products also which are packaged. So packaged food and
Yeah, so even medicine bottles are plastic, unfortunately for children. But there are options available for that. The drug companies have to look at that. The only issue is that the drug companies, because this is a cheaper, more viable and quicker way of dispensing drugs, right? But glass is something which they need to use. Second is, in terms of our day-to-day, our containers which we use for microwave, there are containers available which are non-BPA and non-DHT. So we have to have a government regulation. We need a messaging from the top. We need stricter policing. We can't have plastic bags on the beaches in Bombay and in South. We can't have plastic bags all over the environment. They are going to stay for life, for 500, 200, 300 years. And they get converted in the soil because of the leaching effect again by the sun into micro nanoplastic.
Since you mentioned about microwave and maybe from a clinical point of view, how good it is to heat up the food on microwave and consume?
So there are 3 parts to your question. Is microwave overall safe because of the waves? The answer is yes. Now, what do we put in to heat? We put food and we have a container, 2 parts to it. The container should be non-plastic, non-BPA, non-DHT. Very often, the microwavable containers contain that. Point number 2 is reheating food. damages the food protein. So your bioavailability of the essential amino acids, vitamin D, vitamin B12 goes down.
You mean reheating in any ways?
In any ways, including milk is not good.
No, so reheating on another pan on a stove is also the same?
Is doing the same damage to the ingredients and bioavailability of the food. Most of your vitamins and protein is lost in reheating.
Okay. So the best way is not to reheat, whether
Not
in
to
microwave
reheat.
or...
Cook as much as what you can eat.
Wonderful. So Dr. Bagai, we talked about a lot of choices which can be made and what, the precautions can be taken. We see a lot of disease burden, and you talked about, kidney related issues, also one of that among children now, and obesity and multiple other aspects are all part of it. How do you see certain, the choices which parents are making, or the choices which children are making, how we can change that, and what are the impacts of that in the kids' health, especially maybe the kidney health as well, which is also a reflection of a multiple other, the underlying conditions and all that.
So the big S's are the culprit. The carry home message is avoid the big S's, and the S's suck. Salt kills. Sugar is an inflammatory object, kills. Spirit, especially in adolescence, alcohol kills. Smoking, all age groups, kills. Sedentary lifestyle kills, which leads to obesity and hypertension and diabetes. And last, most importantly, is substance abuse. So the parents should spend enough time in giving the correct value system, correct education, correct path forward to the children, especially at an adolescent, vulnerable age, in which they will carry the correct value system when they become older. So I think the real culprit over here is phones, which have takeaway apps, home deliveries, fast food.
Right.
A simple mid or large size McDonald's burger gives you 80% of your caloric intake just in one burger for a child at 5 years or 8 years or 9 years. Gives you 3 days requirement of salt just in that small burger. 3 days requirement of salt, because it comes with fries and it comes with other stuff. And avoid aerated drinks. Coke, Pepsi, and so on and so forth have a very high concentration of sugar. One glass of Coke, which is dispensed in McDonald's, has 14 to 16 teaspoons of sugar. What this does in the body is it gives a burst. It disrupts your pancreatic function. Your insulin doesn't know which way to go. It causes dysregulation. And these highs and peaks and lows ultimately gives you an imbalance metabolically. So excess salt is terrible. Excess sugar is terrible. Sedentary lifestyle. You don't even have to get up from the bed. It's home delivered.
And I think one more S, which is screen.
Screen time, well said. Screen time. Absolutely. So I think if you look at our childhood, I'm 60 years of age now, but it was difficult to bring us back from the playground or the park. We used to fight with our parents and give me 10 minutes more.
Then now the fight happens.
Here now the fight is that I don't want to go out.
Yes.
So I think it's a cultural issue which we need to deal with. We need a societal issue. We need more areas demarcated as green areas where young children, adults can go and play. I think we need to encourage people going out rather than staying indoors.
And these as are applicable for all, not for kids.
All
it
age
is also
groups,
for the
men and women.
The adults. I think it is also for parents to be careful about these.
Infancy till geriatric age group. Absolutely.
Dr. Bagai, one thing we have seen with the burst of social media and social media being everywhere and almost everyone being on social media, a lot of health messaging is being passed on by anyone and everyone. You can come across all kind of information, whether properly validated or not. How do you see that, and what is your opinion about any health message which we as a people or as anyone who takes or consumes or follows, what they should be careful about? Should they believe on anyone and everyone, or they should look for more responsible and more validated information?
I think under the garb of wellness, under the garb of preventing disease, a lot of misleading information as advertisement is there. Before the social media, it was generally the print or the electronic media, but now it's there you search for something else and another thing pops up compulsorily, unless until you don't stop that ad. I would safely say more than 80-90% of these ads are misleading. They are misinformation, they are false, they are fake, and it's not true. We've seen the quotes coming in very quickly, in which a lot of the longevity issues, the skincare products, making people fair, making skin purer, cleaner, things like that. I think it's misinformation. A lot of the medicines being promoted as a pack of multivitamins giving you extra vitality and X, Y, and Z is again misleading. Food products or protein mixes or children supplementation with milk. I'm not using any company name because I don't want to make it personal against them. That you increase in height. And I can give you 5 names offhand, but I'm not going to use the name. Not true, not proven. In fact, some of them have court cases against them. So I think we need to be cautious when we see the ad. It's an old saying that easy on the lips and forever on your hips, right? You may feel it's very tasty and you're liking the taste, but then you're going to get fatter and fatter and more unwell. So I think it has to be a value system which is driven in from at home, from the parents. It is a value system where the schools have to teach. And I think the schools, we give marks for maths, for geography, for history, for social sciences and languages. Why can't we have a compulsory subject of sports? I have no problem if a child gets lower marks in English or in Hindi or in maths or in science or in biology. Let the guy score 100 on 100 in sports.
So they have a physical education, which is
It's
called
not scored.
PE, but it's not scored.
It's not evaluated. Why don't we incentivize good health? Why don't we incentivize non-obesity? Why don't we give them extra marks for keeping well? Half your problem and battle will be won in the school.
The problem will be even that, just from that point of view, because obese parents will have obese kids, and then the kids will be at a, kind of...
The genetic factors of obesity are few, but the vast majority of obesity is dietary and sedentary lifestyle. Wrong eating, excess eating, and not working out.
Okay, so at the last leg of this conversation, it has been a wonderful to hear all these insights, Dr. Bagai. So you are a visionary healthcare leader, have been contributing immensely in building a healthcare system that is kind of caring, which can last and all that. How do you see India's healthcare now emerging? How do you see that it is reaching to the people who need it? How we are able to bridge those gaps? There has been a lot of great initiatives like Ayushman Bharat and all those major initiatives, and a lot of efforts from Government of India in terms of promoting well-being, like the International Yoga Day, which has created a whole movement around yoga, Fit India, Swasth Bharat, Swachh Bharat. Somewhere I think the messaging has been coming from top of the pyramid in our country. How do you see that it is going, and what is the way forward?
So very quickly, I think the messaging is going in the correct direction. It's a step in the correct direction. It's moving forward. Yoga is a great benefit to all human beings because it tones the muscles, it increases your oxygen supply. It's a part of meditation. It brings calmness. It decreases your stress level, indirectly decreases your cortisol level. All agreed. But Indian healthcare is 70 to 75% still private driven. 25 to 30% is government hospitals. And the way the volume of patients are increasing, at the present moment, the Indian healthcare system is still short of approximately 1 million doctors and approximately 1.5 million hospital beds. So we need to build resources. I must add that the present government in the last 10 years has done a phenomenal job. In the first 65 years, just to give you a quick example, we had one AIMS. In the last 10 years, we have built that one into 24 AIMS. So it's a huge step forward. But with regards to private healthcare, very often we say, oh, private healthcare is a lot cheaper than in US or in UK. Yes, of course it is. But the issue is it still in the price range where an average Indian can afford? The answer is no. Do we have adequate healthcare penetration policies all over India? Less than 2% of Indian population is insured. Ayushman Bharat was a massive, monumental leap in which 50 crore families have been insured for 5 lakhs per annum. It's really appreciated. But we need to go even further. We need proper pricing policy of the private hospitals. We need more standardization of healthcare. We need more digitalization of healthcare. More importantly, we need to make private healthcare accountable. You can't charge and then not publish your results.
Thank you. Wonderful. So, Dr. Bagai, it has been
Thank
an
you.
absolute pleasure, and I think we had a great, insightful, and a lot of eye-opening information.
Thank you.
At the same time, from plastic pollution to air pollution to the kidney health, and a lot of kidney health burden which we may be unknowingly inflicting on our children also. It has been everything but boring. So we have always been trying to bring all those information in a way that people can really see
Easily
that
understand,
health
yes.
information, what makes you live healthy, live well, is anything but boring. And that's why
Thank you.
we kept the name of this podcast, How Boring. So for my audience, if you like this episode, do share, comment, and also spread this information so that many others can get benefited from the very important information that makes you healthy and live well. Thank you so much.